The first agent I want to talk about here is curcumin. You can't have a talk on inflammation without talking about curcumin and all of its amazing benefit. There is an inflammatory response usually that leads to and is part of the autoimmune disease process. And usually patients are put on a variety of anti-inflammatory drugs, including steroids and NSAIDs, other types of analgesics, which don't really do a whole lot, and immunosuppressive agents, which kind of just dampens the immune system even more and end up with other opportunistic infections as well. So, and it can cause a variety of harmful side effects. For example, your NSAIDs exert their action by inhibiting prostaglandin synthesizing enzymes. In particular, both the COX-1 and COX-2 pathways are inhibited, and that oftentimes does result in adverse effects such as GI pain or stomach bleeding, gastric ulcer formation. So again, if we can replace NSAIDs or do things more naturally to try to reduce inflammation, that's what the goal is. Curcumin is one of the yellow medicinal pigment compounds found in turmeric. Experimental studies on cell lines in humans have confirmed findings from animal studies demonstrating that curcumin plays a role in anti-inflammatory response, both by inhibition of the COX-2 and NF-kappa B activation pathways. Here on the right over here, we have our pathways we've been talking about a bunch of times, where we have our activated T cells. And down the line, we eventually have these pro-inflammatory cytokines that are released, including NF-kappa B. And then, of course, over here, we have our COX-2 pathway here. As you can see, curcumin, this line here means that curcumin inhibits NF-kappa B. And this over here, curcumin inhibits the COX-2 pathway, where we don't make as much PGE2. And of course, the 5-LOX pathway as well. And if we didn't, we'd have inflammation and swelling and potentially joint pain or some other type of autoimmune manifestation. So curcumin is very helpful in inhibiting these different types of inflammatory pathways. Let's look at a couple of different conditions in curcumin. Ulcerative colitis, 3 double-blind, randomized, and placebo-controlled studies. The amount of curcumin ingested would range from 140 milligrams up to 3,000 milligrams daily. The mean dosage of curcumin for the clinically effective studies was around 2,500 milligrams. 2 studies reported a decrease in clinical activity or an increase in clinical remission, while one study, that was a study that revolved around 450 milligrams per day, reported curcumin as ineffective in reducing remission. So in 2 studies, the dietary curcumin supplementation resulted in improvements of at least 3 clinical measurements. So at least 3 clinical measurements. So truly, I think you need to get to at least 2,000 milligrams. 1,000 milligrams would be the starting point. See how somebody feels. 2,000 to 3,000 really is the area that you want to be to help patients with ulcerative colitis, according to this study and where I practice clinically as well. This was a study that looked at both UC and RA, rheumatoid arthritis. This is a 2021 meta-analysis of 6 studies. It showed that curcumin supplements in the dosage ranges of 250 to 1,500 milligrams per day over 8 to 12 weeks was associated with a decrease in ESR and CRP in adult patients with rheumatoid arthritis and ulcerative colitis in comparison with the control group. So clearly there was a reduction in inflammation systemically. More dramatic reductions in both markers were seen in younger patients, those less than 40 years of age. Then interestingly, longer duration, greater than 8 weeks, and larger curcumin dosage also resulted in greater changes. So again, it's kind of what I was just saying. Again, if you can get to 2 to 3 grams, potentially even 4 grams of curcumin, that's where you want to be. And as I've always said through many of my different talks with you guys so far, is that 3 months really is the area that you want to be in to see if you have any kind of clinical benefit. All right, so this is curcumin in MS. This is an in vivo study, so it wasn't a randomized controlled trial, but that's okay. It showed that curcumin can promote the differentiation of oligodendrocyte progenitors and to counteract the arrest of these progenitors induced by tumor necrosis factor alpha. What does this mean? Well, sometimes we have this inflammation that prevents our oligodendrocytes from differentiating, right? And these oligodendrocytes are the ones that are eventually going to be making myelin. So tumor necrosis factor alpha is an inflammatory cytokine that causes the damage and causes them to prevent them from making myelin. So basically curcumin was arrested that process in vivo. And no human studies, unfortunately, have shown the investigation of curcumin in MS. This is an amazing picture over here. Don't have time to talk about the entire thing, but here basically we talked about this a little bit last time with the fact that MS is associated with these cytokines that translocate across the blood-brain barrier. We also have the activation of these macrophages. We also have the Th17 cells, all of which cause the degradation of the myelin here because we have autoantibodies against myelin. So what I wanted to show here is that curcumin has many different roles. You can see here in this respect here, as does vitamin A and resveratrol. Curcumin is also active all the way up here in helping this immune process. And it's an active over here as well in helping to inhibit the release of these cytokines from the T cells. So curcumin has many active roles, as do a lot of other very important nutrients that unfortunately we don't have time to discuss. Vitamin D is on here, resveratrol is on here, which we will talk about briefly. Quercetin is another extremely important flavonoid that is amazing, has a lot of very important roles in the body. It's widely present in fruits, herbs, vegetables, including apples, black tea, berries, capers, red wine, and onions. Quercetin reportedly exerts powerful anti-inflammatory effects, mainly by inhibiting cytokine production, reducing cyclooxygenase and lipooxygenase expression, kind of as we were talking about a second ago with curcumin, and maintaining the stability of mast cells. We haven't really talked about mast cells a whole lot, but mast cells are part of your immune system, and mast cells are responsible for your kind of more of the allergic response in individuals. Mast cells release histamine, and that usually causes allergies or other types of issues in individuals. And mast cells also are associated with autoimmunity as well. So quercetin, in my opinion, prevents mast cell degranulation. It kind of helps to make the mast cells be healthier and prevent them from releasing histamine. So it can work very, very well with respect to allergies. Quercetin has undergone clinical trials. To date, no significant toxicity or side effects have been observed in humans. So you can take this at quite large dosages without having any issues. And inhibitory effects of quercetin on inflammation have been observed in multiple studies and looking at multiple different autoimmune processes here. And it has the capacity to suppress multiple types of cancer as well. So it could be used as a cancer treatment too. In RA, quercetin of 500 milligrams per day, which in my opinion is pretty low dose for 8 weeks, significantly reduced morning stiffness, morning pain, and after activity pain. These activity scores and pain scores were decreased in the quercetin group compared to placebo, and the number of patients with active disease significantly decreased in the quercetin group as well. Plasma tumor necrosis factor alpha levels were significantly reduced in the quercetin group compared to placebo too. So really cool study for RA. How about for IBD? Quercetin has been shown to be a potent anti-inflammatory compound in a variety of both in vitro and in vivo bioassay models, but oral quercetin has not exhibited the desired effects in colitis. This again could be partly because it's absorbed in the upper GI tract. It doesn't necessarily reach the lower GI tract, kind of as our conversation with butyrate from before. So the rapid metabolism of quercetin is disadvantageous with respect to treating IBD, unless the flavonoid, sometimes we can use it in its glycosylated form, which is the compound rutin. So rutin is another way. Rutin is also found in a lot of fruits and vegetables, and you can also get this as a supplement form as well. And rutin is hydrolyzed by the gut bacteria in the colon to synthesize quercetin. So it actually may act as a prodrug, with quercetin being the active component. So if you have patients with IBD and you're looking to use quercetin as the anti-inflammatory agent or an anti-inflammatory agent, you might use a rutin to help to be able to convert it into quercetin in the gut. And then in MS, in an in vitro study here conducted using peripheral blood mononuclear cells from patients with MS, treatment with quercetin reduced their proliferation and modulated levels of IL-1 beta, this thing called metalloproteinase 9, which of course is involved in degradation of myelin, and tumor necrosis factor alpha, again, which is also involved in this whole process of myelin degradation in cell culture supernatants. Mast cells, here again is our conversation on mast cells, they are involved in inflammatory processes and allergic responses in which immunological stimulation causes the production of inflammatory mediators or cytokines. It's been suggested that mast cells are the immune gate of the brain. Mast cells are the immune gate of the brain and are likely associated with neuropathologic processes, including MS. So quercetin, I think, is extremely important when it comes to MS. Over here on the right, we have, again, so we have quercetin taken orally here. It has a whole variety of roles here in reducing inflammation and helping to lower a variety of cytokines, including tumor necrosis factor alpha and IL-1 beta over here and NF-kappa B. That causes reduced proliferation, reduced immune imbalances as well, and kind of hopefully improved MS. Reduced oxidative stress. It is also kind of a free radical scavenger, and it can reduce oxidative stress in the body as well. And that, of course, is going to be able to help reduce nervous system damage too.